think we all know what intentional traumas are. That's someone who has been physically or sexually or emotionally abused during childhood by an adult. There's also, and we know that they have an increased risk of developing addictions. We also know that there's unintentional traumas. And unintentional traumas are things like being raised in poverty, parents going through divorce at a young age, the death of a parent or a sibling at a young age. Those sort of traumas also increase the risk of developing addiction. I want to give a little example about this from my own past. Not a big trauma, but just to talk about the fact that those sort of traumas and pain from our childhood is what I call painless. What I call timeless. It sort of tends to stay with one. Okay? It's a timeless sort of trauma. And so, like I said, a little example. My father was born in 1915, and he lived through the Great Depression and lived through World War II. You know, and so when the Second World War ended, my father did what most good men at the time did. He wanted to provide for his family. He worked hard, went to school, got educated to try and provide for his family. Because he grew up poor, they didn't have much. That was his number one goal, was to provide for his family. Well, you know, when I was growing up, as a result of that, my dad was not at my sporting events, was not around as much. And as a kid, I missed him. I felt that pain. And I don't resent him for that. He was doing what I think most good men at the time were doing. But as a boy, I still felt that he wasn't there and noticed that. So when I say the pain is sort of timeless, what I mean by that is, so if I'm in my office today seeing patients and 5 o'clock's rolling around and I'm thinking, my daughter's got a soccer game. You know? In my head and in my heart, I'm thinking, I want to get to that game. And so I haven't forgotten what it was like when I was a kid to not have my father there, okay? That's what I mean when I say pain is timeless sometimes. We're going to come back and talk about that a little bit later. What other factors go into determining who develops an addiction? Stress. Okay, so I always like to, usually I have much bigger audiences, but I like to say, raise your hand if you don't have stress in your life. And I never get a hand, you know. So the point is that if stress caused addiction by itself, everybody would be an addict or an alcoholic, right? It isn't, that's not true. But stress is a factor in who develops addiction. How we learn, whether it's learned or whether it's something we develop, how we deal with stress in our life, how we learn to cope with stresses in our life is a factor. And there's certain personality traits and certain personality characteristics that go into determining how we deal with stress. And so stress is a factor. Another factor is availability. As Ann mentioned, I'm the director of the professional program as well as the addiction program over at Ridgeview. And the professional program, we have nurses, doctors, pharmacists, as well as other, we have lawyers and other people too, but the healthcare professionals have a higher incidence of developing addiction than it's an occupational hazard. So they're working around the availability of drugs is there all the time. It's not just another example of that. I think it's not a stretch for people to understand that maybe people that work as a bartender have a higher risk of developing alcoholism. And you know, another example I like to give is, let's say you grow up in the inner city, and you every morning on the way to middle school, you come out of your house and you walk past the crack house on the way to school every day. On the way home from school every day, you walk back past that crack house. You are at a higher risk of developing addiction just because of the availability. AA has a saying for that, by the way. AA says, if you hang around the barber shop long enough, eventually you're going to get a haircut. That's what AA says. So, availability is a factor. The final factor I want to talk about that goes into developing an addiction is psychiatric comorbidity. A very important factor. Untreated depression, untreated anxiety, untreated bipolar disorder, untreated personality disorders, they all have a much higher risk of developing addiction. So it's very important to have psychiatric issues diagnosed and treated. There's a whole sort of like a field devoted to that, dual diagnosis. very important. One of the biggest reasons for people not to recover from addictions is they have untreated psychiatric problems. It's very important for them to be seeing a doctor that understands the basics of addiction. And some doctors will give you addictive medications to deal with your psychiatric problems, and that's the wrong thing to do as well.
Is this pattern common to most addictions, whether they be alcohol, drugs, gambling, internet addiction?
There's, for example, gambling. The studies show that that they have genetic basis as well. And one interesting fact about gambling is 80% of the gambling addicts have alcohol problems at some point in their life. See, they travel together. And the same factors, you have psychiatric comorbidity, stress, availability, they're all factors in all different addictions. So now, I don't know if you all really care that much about brain chemistry. You want to hear this, or should I skip over it? I mean, brain chemistry, some people really find it enjoyable. And,
yeah, let's hear it.
huh?
Let's hear it.
Let's hear it, okay. So, brain, we're going to talk about brain neurochemistry and adaptation. So this is a sagittal section of the brain, okay? And a little neuroanatomy here. This here is the brain stem. This is the most primitive part of our brain. It's the part that controls our breathing, our respiration, our blood pressure, the very basic bodily functions. This here is the midbrain area. That's sort of not nearly as primitive as the brainstem, but not like the cortex. The cortex is the higher cortical functioning of the brain, part of the brain. That's the part that us humans have a lot of. Okay? So, for example, frogs have a midbrain, and frogs have a brainstem. They don't have cortex. Okay? Us humans have cortex. So higher cortical functioning. But this midbrain area is, as you can see here, I have the median forebrain bundle. That's the part of the brain where the pleasure centers are seated. Okay? All alcohol and drugs of abuse affect the dopamine pathways in the pleasure centers, which are located in the median forebrain bundle that are related here to the midbrain area. The midbrain area is where our drives are seated. Right? Our drive for hunger, for thirst, for sex, for the drive for addiction is there too, which we're going to talk about. So, and then this part here, this amygdala and hippocampus area, that's where the memory is sort of, our memory is sort of seated, and where certain behaviors and events have an emotional coloring to them that we remember. So, for example, cravings are thought to be seated in the amygdala and hippocampus area. So, for example, if I'm driving in Chicago down Wrightwood Avenue past the Burwood Tap, which is one of my old watering holes, okay, my amygdala and hippocampus light up because I have memories of that spot, okay? And that's sort of how cravings are thought to be. And you can see how close all this is related to the midbrain area where our basic drives are seated. So I want to give you a little example about how this is thought to work with addictions, okay? So let's take the example of the alcoholic who's driving home from work one day, and he gets pulled over after he's stopped at the bar. He gets pulled over by the police, okay? And he's pulled over, and what does he say? His cortex says, "Oh boy, crap, I'm in trouble. Another ticket. My wife's going to be really pissed at me. I have legal problems. I'm going to have another DUI to deal with. I might lose my job. I'm really in trouble." Okay, that's what his cortex says. Okay, well, what does the midbrain say? His drives, what do they say?
Forget about it. Don't worry about it.
Actually, the midbrain is primitive, as I said, so really it doesn't talk, if you will. But if it could talk, it would say, have another, have one. And the reason it says that, that's what it's used to doing with certain feelings and situations. It's used to, so there's this